small number of women have come down with an extremely rare blood clot after getting the shot.
This is a really rare event. If you look at what we know so far, there have been 6 out of the 6.85 million doses, which is less than 1 in a million.
All 6 women were between 18 and 48 years old. They got sick about 6 to 13 days after getting vaccinated. The clots formed in veins of the sinus and prevented blood from draining out of the brain. One woman died, another is in critical condition. There's no evidence showing the vaccine caused the condition, and to be super clear, your chances of getting struck by lightning are nearly twice as high, 1 in half a million. But the FDA is warning anyone who got the Johnson & Johnson vaccine in the last 3 weeks to be on the lookout for severe headache, shortness of breath, abdominal or leg pain. And if you need treatment for a blood clot, they strongly suggest avoiding the commonly used blood thinner heparin, which they believe adds to the complications.
That would be a mistake in this situation because it could be dangerous and make the situation much worse.
Health officials say that these rare immune responses have only been seen in viral vector vaccines. Johnson & Johnson is one, AstraZeneca is another. Pfizer and Moderna use a different technology. Very quickly today, the federal government put a hold on using the shot at mass vaccination sites, and at least 48 states followed. The nation's governors tonight are beyond frustrated. In a phone call at the White House, they question the wisdom of putting a hold on a vaccine over such small number of cases.
The ability for governors to reinstill confidence after something like this is 100 times harder than putting the pause on in the first place.
People who've already gotten the shot are worried, and now there's more of a scramble. CVS and Walgreens, for example, are rescheduling their Johnson & Johnson appointments.
I don't want to take any chance, it's my body, and I want to be safe.
The president tonight is trying to reassure Americans that there will still be enough vaccine from Pfizer and Moderna. Late today, Pfizer announced that they now expect to deliver their 300 million doses about 2 weeks ahead of schedule.
There's enough vaccine that is basically 100% unquestionable for every single solitary American.
And Steve Osensami joined us tonight from the CDC. And Steve, what are we hearing so far from authorities on this? How long do we expect this temporary pause of the Johnson & Johnson vaccine to last?
Well, David, federal health officials were asked that same question by the nation's governors today. The answer was days, possibly weeks, hopefully not months. There's a public hearing on this issue tomorrow. They're encouraging anyone with those symptoms to call their doctor. And one criticism that we're hearing from people who are upset with the government's response to this is that it's really hard to scare Americans and then later on try to unscare them. David?
Steve Osensami.